Hello, I'm Gretchen Musicant, a member of the Social Justice Ministry team that brings these social justice forums to you. I'm also the Commissioner of Health, where the Office of Violence Prevention sits in Minneapolis. Our theme this year for all of our forums is Wade in the Water, Becoming Anti-Racist. Every forum we hold is meant to encourage all of us to listen intently to voices beyond those of white privilege, and to reflect on how we, as a community of faith, can help change a racialized system. So our topic today of transforming public safety is certainly one that will call us to wade in the water and examine and think about how we can help change the racist components of our current system. We have two wonderful guests today, Sasha Cotton, who is Director of the Office of Violence Prevention, and Jen White, who is the Community and Interagency Engagement Manager in the Office of Violence Prevention, both of which are in the Health Department. Since the death of George Floyd nearly a year ago, there have been heightened calls to rethink our approach to public safety. And I say heightened because we have heard those voices and they have been present for a long time, way before the death of George Floyd. Minneapolis has been investing in a public health approach to violence prevention since 2006 and officially adopted a plan called the Blueprint for Action. The City Council adopted that in 2008. Sasha has been our leader in that effort, working in the Health Department to prevent youth violence, and now more broadly, for 9 years. During that time, we have really expanded the work from youth violence, where we started, to including violent interruption, promoting healthy and violent-free relationships, and so much more. So while the terms transforming public safety, reimagining public safety may seem new to some of us, the work of using non-police-centric approaches has been and is a growing practice in Minneapolis. Earlier this year, the City Council asked the Office of Violence Prevention to coordinate community engagement focused on reimagining public safety. And we are so pleased that Jen White has been able to join us to help lead that effort. Jen White has deep roots in Minneapolis as a resident, as a policy aide to former Council President Barb Johnson, and as a policy aide to Mayor Fry, focused on public safety. We are honored to have these two leaders with us today to talk about transforming public safety. I'll be posing questions from the chat after we hear from our guests. I'll turn it over to you now, Sasha and Jen.
Well, thank you for that warm welcome, Gretchen, Commissioner Musicant. We are very pleased to be here and looking forward to spending some time talking about the reimagining and transforming of community safety. As you had mentioned, I'm joined by Jen White, who is really leading on much of this work across the enterprise and in community. I'm going to share some slides here in just a few minutes, and then we are happy to jump into some Q&A where both Jen and I are happy to take some questions. So at this time, I'm going to share my screen and start a brief presentation that will talk a little bit more about our reimagined work or our transforming safety work. Give me just a moment. All righty. So this is our first slide. And just so that everyone is aware, this is one of the visuals that people may begin to see more coming out of the Office of Violence Prevention. And it really does talk about how the faces of violence prevention look like all of us. And that's really important to this work because many times we start to think that there's a particular type of person who might experience violence or who has a responsibility for helping to prevent it. And our motto in the Office of Violence Prevention is that we are Minneapolis and that it takes all of us to prevent violence. And so this visual around the city may very well be seen soon, as well as some others that really indicate that collective impact around preventing violence. So transforming community safety. We're developing new models for community safety, especially focused on ensuring that every member of our community feels a sense of safety. It truly does take all of us to create safe communities and to prevent violence. And so we want to really ground ourselves and our communities in this framework that we all have a role to play, whether that is organizing a block club, actively volunteering with a violence prevention organization, or just being a really great neighbor. We all have a role to play in a way that we can help to keep our communities safer. And so we want people to really be thinking about that, particularly as we try to reframe what we mean when we say safety. And we begin to really think about moving away from our deep necessity for policing, recognizing that police have a role in public safety, but that in many ways we've over-relied on them for the last several decades in this country. And as we move to different systems of safety, we all will have an active role to play. So our community safety models and priorities are really anchored in a couple of big picture buckets. Prevention, which is our work out of the Office of Violence Prevention. So really breaking the cycle of violence before it begins, thinking about ways that we can interrupt violence actively as it happens. And when you think about the public health approach, we operate from a prevention pyramid. So the base of our pyramid is primary prevention. And that is really about creating happy, healthy, and hopeful communities where people are well positioned to thrive and be successful in a wide range of things, including being violent free. The midsection of a typical prevention pyramid is focused on what we might think of typically as intervention. So working with those who maybe have high risk factors for being a victim or perpetrator of violence, and ensuring that services are available and widespread knowledge about how to prevent violence is made available to people in that particular segment of the pyramid. And then the tip of the pyramid, much like the tip of the iceberg that we, philosophically think about all the time. People say, "Oh, this is just the tip of the iceberg." The tip of our pyramid is what is known as tertiary prevention. And tertiary prevention is really that top tier of the pyramid that is often most visible in community. It is the repeat impact of violence. It is people who have already experienced violence as a victim, a perpetrator, or both. And really ensuring that that very small segment of our community that is deeply involved in violence is having its needs met, and that we're really addressing retaliatory and ongoing violence within that community to mitigate future interactions with violence. The second bucket of our work is about alternatives. And this is definitely newer work for the city of Minneapolis. Looking at alternatives to 911 calls is an important way to shift our focus away from just policing as a public safety process and to think about alternative responses. So one major example that's been lifted up and that's being worked on right now in Minneapolis is alternative responses to mental health crises. We know that a number of people call on every day 911 because a loved one is having an experience with a mental health crisis. And oftentimes the presence of law enforcement, one, is not the best service delivery for that individual and family. And two, the presence of law enforcement can often escalate the circumstances just by the very nature of them being there. We want to make sure that people are getting the best possible response. And for that reason, the city is looking at alternatives and will actually be launching some work related to that this summer, having mental health practitioners responding to nonviolent calls for service related to mental health response. So we're very excited about that and looking forward to expanding that scope of service. The last body of work is an ever evolving one, but is really about reform. And so thinking about policies, procedures, not only in the police department, but throughout our enterprise that will improve our service delivery related to public safety. So developing these new models, we're basing this on community engagement and input, evidence-based research, and exploring opportunities for structural changes. Our engagement principles are accessibility, meaningfulness, and inclusivity. And I think it's really important at this point to note that when we talk about developing new models, although there are some things that we've been doing in Minneapolis for some time, there are models of this kind of work that have been used throughout the country and throughout the world to lean into alternatives and prevention and reform as options to make our communities safer. So we're not starting from scratch. We do have policies and procedures and programming that we can borrow from local jurisdictions across the country, and that will help us to do our work better. That's really where those evidence-based research models can come into play, and the relationships that we've built with national institutions like John Jay College, the National Network for Safe Communities, and Cities United, who are leading the work nationally on these policy and program issues. So our engagement phase has 4 phases, and it is first to gather information. So we've completed that phase. That was done through surveys and other opportunities for community to give information, to dive deeper into that collection. And then we'll be drafting recommendations and presenting those recommendations. And we'll go a little deeper into each of these phases in the next few slides. So phase 1, which has been completed, included community surveys, which was an online format, stakeholder interviews. So those were interviews, and we did use some mixed methodology, which allowed multiple voices to be included in this, which means that we at the city identified the baseline or the first few interviews, but then our consultants actually asked those being interviewed who else they thought that the city should be talking to ensure that we weren't just selecting people who we thought might have a particular viewpoint or might be more supportive of our work. The next set of engagement was with our policymakers. We know that a number of our policymakers have been out engaging with their constituents in a variety of ways since the death of George Floyd, and we wanted to make sure that what they were hearing from their constituents was also captured in our collection of information. We had a number of community engagement sessions, and we continued to conduct research on those evidence-based practices that I mentioned before. So our engagement survey launched on October 30th of 2020 and was intended to capture input on the current models of community safety that are being used in the city of Minneapolis. The survey was completed by 9,559 people. We recognize that that is a relatively low threshold compared to the size of Minneapolis, but this was just a sample, and again, just one way that we're collecting information. The themes that came out of the survey, or the frequently mentioned themes that we heard, were that there was a value in action and change, that people wanted to see equity, justice, and reform, and decreasing crime by investing in violence prevention, mental health, and community wellness or community wealth building strategies. Phase 1, around the engagement with stakeholders, we conducted interviews between November 16th and December 21st. These sessions were for 1 hour, and interviewees could suggest other community members that they thought we should be talking to. Again, that was a constant question throughout. We interviewed a wide range of different kinds of groups within the city of Minneapolis, which included our neighborhood associations, business associations, BIPOC communities, GLBTQAI communities, those working on public safety, faith leaders, renters, and cultural organizations. Interviews with policymakers, again, those were conducted with our mayor as well as all of our city council members. And we captured and recorded this independent engagement that each policymaker had been doing since George Floyd was killed on May 25th of 2020. Again, really wanting to ensure that all of the work that the various policymakers had done to engage with community were also captured in this report that we'll be doing. Community sessions, we held 18 focus groups with different cultural communities. There were 7 major themes that emerged, and groups were really excited about supporting next steps in the engagement process. I know for sure that one of the things we heard was that people felt like the 1-year commitment that our city made to reimagining public safety was simply not long enough. And that is certainly one of the things that we'll be lifting up, that this can't be a one-stop opportunity, but will really need to be done for a long period of time as we reimagine and reestablish what it means to be safe in Minneapolis. So our research has been focused on identifying existing models of community-based violence prevention and alternative responses. Our research reviewed scientific literature, media, and public websites. We used 3 consulting organizations: Myers Consulting, Solace Consulting, and Minneapolis Health Department's research team. We are still in the process of getting community engagement with some self-usable tools and techniques. So we do have a meeting in a box, that's a facilitation guide. I'm gonna certainly encourage Jen to jump in here and talk a little bit more about what that looks like when I complete the list. We have community office hours, both within the Office of Violence Prevention and with a wide range of our public officials, particularly our city council members who are very interested in this topic and who have been hosting meetings about it. We're doing a series of learning labs And again, I know Jen is prepared to talk a little bit more about our first one, which is coming up next week. And then updates through our Public Health and Safety Committee. We do a presentation on a monthly basis to the Public Health and Safety Committee, where we offer updates about our work generally, as well as where we are in the transforming community safety work. Jen, do you want to take a minute and talk a little bit more about the Meeting in a Box?
Sure. With the Meeting in the Box facilitation guide, we recognize that a lot of these conversations are happening in various locations, with your neighbors, at home, and certain organizations that you may be involved with, and certainly within your faith communities. And we wanted to provide an opportunity to help guide those conversations and to allow people to provide that feedback back to the city. So along with the facilitation guide, there is a link to a smart page that you enter in the feedback from those conversations, so that that is also included in the analysis that we're doing, and just offering various options for folks to plug in and engage on this topic. And I also note with the community office hours that will be launching soon as well, those will be provided to community to just make appointments and just come and ask questions or have a conversation with myself or other folks who are involved in the transformation of community safety work. And then the learning labs, we also recognize that there is a need to just provide more information to community on topics related to transforming safety. So with those, we will be taking a deeper dive with some of our local and national partners on specific topics. We will be recording all of those sessions and make those available on the community safety webpage as well. So if you're not able to catch it live, you'll be able to certainly link back and reference those opportunities as well.
Thanks for that, Jen. So moving on, our group discussions were really focused on reflection or feedback that people are hearing, what other questions they might have, and what they need from us. Oh, I think we jumped ahead a bit. Well, we got through that much faster than I think we anticipated, but we're good on timing. And so Gretchen, I'm gonna turn it back over to you in just a moment here, but I do wanna note that we have listed here our website where people can find more information about the various initiatives that we're leading, as well as the community safety work that we've presented here in this presentation. And at this time, we will gladly turn it back over to you, Gretchen, to take some questions and respond to any inquiry that you might have. I'm going to stop sharing my screen.
All right, thanks to both of you. So one of the things that you outlined that we did in phase one is to look at models from other communities. And I'm not sure that everyone listening to this forum today really fully understands the scope of models that we already are applying and using here, and then ones that we might be exploring beyond that. And wonder if you could share a bit of that.
Sure, I'll talk a little bit about the way we do our work in the Office of Violence Prevention, because one of them is really a focus on evidence-based practice. And so we've been thinking about our work over the last year or so in three large buckets. The first of them being evidence-based practice and the use of those practices in our work. And I will say that that is where our deepest financial investment is. The second bucket is really about innovation and capacity building, recognizing that there's real brilliance in community and that Minneapolis residents, those who live, work, and play in Minneapolis, often know what's most needed in the city, and that there's active work happening, and we want to support that work. We also want to build the capacity of organizations both to look at their work as potential evidence-based practice in the future, so that if they have something that's really amazing, that we can take them through a process that would help them evaluate that work and maybe get to the next level where that could be evaluated by a research and evaluation team at a university. We want to help them explore that, but also just want to continue to nurture the work of community-based organizations and their ideas. And then our third bucket is really about community engagement. In the 2020 budget, the City of Minneapolis City Council made a variety of shifts around public safety. And one of those was to move the community navigators who have typically been housed in the Minneapolis Police Department to the Office of Violence Prevention. And that work is very innovative, but it definitely is focused on engaging with our community partners and ensuring that they know what the city is doing around public safety. So we're really excited about that addition to our office and building that work. And so that is really the third arm of our work around community engagement. So doubling back to evidence-based practice, in Minneapolis, we have what we call our big three, which are evidence-based models. And that would be our group violence intervention, our hospital-based work, and our new replication of cure violence. All of those are programs that have been researched and evaluated heavily and have been shown to have significant impact, particularly on reducing gun violence in communities. Cure violence and the group violence intervention focus very specifically on those who have been impacted by group and gang violence. And so we know that research shows that in most major cities, about 60% of gun violence is driven by gang and group involvement. And as we've researched that in Minneapolis, we found that we are right on trend with that data, although things are always shifting and changing. And so we felt that it was very important to develop and replicate models that have been shown to be effective in other places to focus on that demographic. And then the hospital-based work is a little bit more expansive. It is currently housed at HCMC, North Memorial, and we've recently expanded to Abbott Northwestern, so that we're able to provide an immediate bedside intervention to anyone who is shot, seriously injured by violence, or otherwise impacted with a victim experience that comes to the hospital with serious injury from violence. And we know that that's so important for a couple of reasons, because when people come to the hospital with a serious injury, through modern medicine, they are often able to get patched up and sent home very quickly. And no one is really taking the time to ask the question, what happened? Is it safe for you to return home? Are you thinking about retaliation? We know that to a certain degree, hurt people. And we want to make sure that we're mitigating for those factors and that we're providing people with the resources and really the support that they need in order to successfully transition back to their home life in a way that supports their success, not only in their recovery physically, but their mental recovery and their recovery from a very traumatic event that sometimes goes under-evaluated through the best medical care, but doesn't always get to the root sort of social service and mental health needs that we know people might need help with. And so those are our big three that are definitely replications of evidence-based work. And we continue to look at other models around the country that have promising or that are either promising or have been shown to work in other jurisdictions, because we think it is important to follow the best recipes. And that's kind of the way we think about them, is these are the Emeril Lagasse recipes of violence prevention. And we want to adapt them and add a Minneapolis flair, but we want to ensure that we're following them with fidelity so that we can get those same improved outcomes. Many of these have seen up to 40% reductions in violence when implemented with fidelity. So we're excited to be replicating those and have been doing that for some time and continue to grow that body of work.
Thank you. That's so helpful. One question that has come up is, we know that there are a number of ways that the police department and its work are being looked at. There's the ongoing police conduct oversight committee. There are other efforts to look at how police might reform their practices. And so just a little bit more, if you have, about how all that gets tied together or is different.
Yeah, a lot of that work is led through policy. And I know that Jen has had a robust opportunity to be deeply involved, both when she was working for the mayor's office and now in her current role. So I'm going to ask her to start us off with an answer to that question, and I'll chime in as I see fit.
Sure. Thank you, Sasha and Gretchen. So with the policy reforms, and it's happening largely internally with the police department itself, with the guidance of the mayor's office, I think under Chief Arredondo's vision, at the core of some of those policy and training changes are really trying to get at a culture shift. And how are we encouraging our officers to feel a sense of community with the city and the members of the community that they're serving, and work really toward fostering that. And I think they do that through various initiatives. And some of the big things we've seen and shifted were around some of the training and reporting, just to ensure that there is increased accountability and as much transparency as possible. There's also right now an investigation underway by the State Department of Human Rights, and that started last year in 2020 after the killing of George Floyd, and they have provided a series of recommendations that have been implemented as well. So I think it's really trying to get at how can we ensure that we are providing the best service that is centered and grounded in community with increased accountability and transparency.
Yeah, I think that, some of the specifics that you offered, Jen, are very helpful. And I've, been talking a little bit about this as we think about a shift and change in our systems, is that we've really overtaxed our police department. And that's not just a Minneapolis issue, that's really a national issue. As we think about young children are taught right away, if you see something, say something. If you see something, call 911. If you have a problem, call 911. And of course, we want, children to be equipped and communities to be equipped with resources in order to get support and services when they need them. But oftentimes police are not the right response, and that we need to be building out these broader systems of public safety, much in the way that we think about healthcare. I usually use this analogy that both of my grandmothers are in their 90s, and they both will say, if they're ill, I need to go to the doctor. But in fact, when they go to their clinic, they're going to see lots of people before they actually see a doctor, if they ever see a doctor. They're going to see a medical receptionist to check in. There's going to be an MA who takes them back and does their vitals. If they need blood work, there's going to be a phlebotomist who does that work. They may see a dietitian. So really thinking about the system of public safety, in many ways, we've gotten to a place where we think about the police as the doctor, right? That they're the go-to when we think about public safety. And we really want to build out systems that support people doing their best work. So you think about the work that we're building under Cure Violence and the violence interrupters. I would bet my bottom dollar that violence interrupters are better at de-escalating conflict than law enforcement officers, because that's what they're good at. That's what they're trained to do. That's their skill set. Just like I would much rather have a phlebotomist take my blood than a doctor, even though doctors have gone through rigorous medical training and they certainly can draw blood. Phlebotomists do it every single day. They know how to get that vein to pop, and they know just how to get the needle in. And so it really is about building out a system that allows us to lean into the best skill sets under the best set of circumstances. And I think that's really what the transforming public safety work is about.
Thank you. Early on, or as part of your presentation, you talked about moving into some new models for addressing mental health needs. And I'm wondering if you can give us a little bit more of the backstory of some of the work that was done to get us to this point, to learn and think about where are the plans to change things up a little bit.
Sure. Jen, do you want to talk a little bit about the 911 work group and how it's grown into some bodies of work? And I'll add if I see a need.
Perfect. Sure. So back in, I believe it was 2019 now, maybe late 2018, the City Council recognized that we needed to take a closer look at the types of 911 calls that were coming in and the responses that we were sending out. And they wanted to do that not only internally with our expert staff, but also involving community. So they assembled a work group, the 911 work group, and they really intentionally looked at all of the calls that were coming in and where they were, the volume of calls, the coding of the calls, and they developed a set of recommendations based on their research, and they provided that back to the City Council. And one of the things that they saw, and I think that we certainly continue to hear again and again, is around the response to mental health calls. And just as Director Cotton just mentioned, who are we really sending out to those calls, and who would be actually the best and most equipped professionals to be responding to those? So out of those recommendations, that was the one I think the city council decided to focus on, and provided some funding this year to develop a pilot program that would send out behavioral health specialists, professionals to those calls that are not violent, those mental health calls that are non-violent, in order to provide the best service and make sure that we are meeting the needs of the community members who are many times our most vulnerable, who may be experiencing a crisis with mental health. So they have been working hard. Our city's Office of Performance and Innovation to get that pilot up and running. I think they are getting close to making some updates and announcements, and we certainly hope to see that pilot up by this summer, where we will have that type of response to those types of calls coming in.
And I would just add, it's my understanding that that pilot is going to offer 24-hour service, which is one of the things that often comes up, recognizing that a lot of alternatives are like sort of 9 to 5 or 9 to 9. I think that this one is particularly exciting because it will offer a replication, much like traditional 911 response, that if you call in the middle of the night or the middle of the morning, you will still be able to get that non-police emergency response to a mental health crisis, which is going to be very, we're very optimistic at the city about what that's going to look like. And, big kudos to our partners in the innovation team who work very closely with us on the transforming community safety work, because they have been really leading on that arena and doing some amazing work.
Thank you. That's so helpful. I think in one of your early slides, I also saw something on it about the importance of healing and reconciliation. And so just thinking about faith communities and that need for healing and reconciliation, wondering if you have thoughts about how we can knit those together that faith communities could play in helping support that.
Sure, I've got my own ideas, and I'm sure Jen does as well, and probably is more informed about some of the city's actually policy area responses to that topic. So I will just say, as a person who grew up in a deep faith community, that I think the role of the church and faith-based communities is really essential when we think about this body of work. We know that in government, we can't pay for people to proselytize, but that in most religious organizations or faith-based organizations, the principle of doing good and taking care of others is at the center of faith. And I think that that is really what this work is about, whether that's through systems or individual people. We want people to see how they can take better care of themselves and therefore be in a better position to take care of others when in need. And so I think that encouraging faith communities to be deeply invested in the Reimagine work is critical, and that people are often in faith-based communities willing to be more vulnerable than they are in any other place. I often say church is the place I cry the most. And so I feel like there is a freedom in being in a place of faith that allows people to really begin to think about their own healing that can be very cathartic to the journey around safety. And so that's my personal opinion. And I'll let Jen chime in with her own thoughts, as well as any policy updates she might be able to offer.
Sure. Thank you for that, Sasha. And I think to add on to that, one of the pieces that has been recognized that we as government have caused harm to communities. And we need to certainly work at not only correcting ourselves moving forward, but how can we reconcile that by acknowledgement, and then how can we work side by side, hand in hand with community to repair some of that and foster the healing that we need to move forward together as one city and as one community. And at the city, as far as the policy aspect of that goes, that work is being led by Council Vice President Andrea Jenkins and our Division on Race and Equity, in order to really have those very intentional and at times painful conversations with community and learn from them how we can move forward together.
Yeah, just one more note on that. I think, it is very important that our city is looking at this process of reconciliation and the damage that government has done. And in the conversations that we've been having, I think particularly focused on public safety, it becomes very easy for people to focus on just policing as the government entity that has caused harm. But generally speaking, whether it's through renter associations and public housing or public health, there are lots of places in which government has inflicted harm, particularly on low income communities of color, those who have been underserved. And so I think the process of reconciliation and really owning, whether it's us as individuals, we work for an entity that has caused harm, and we do have to begin to name that and really acknowledge it as we try to do better. So I'm glad that you raised that, Jen.
Thank you. Oftentimes we hear in the news about violence in school settings. And I know that in Minneapolis, we've had a transition recently in how safety and security is addressed in the Minneapolis public schools. And just wondering if you can talk to us at all about our relationship with the schools and how we have helped in that transition. Anything else you might want to say?
Sure. As you mentioned in my intro, I started with the city with a focus on youth violence prevention. And that work remains near and dear, not only to me personally, but to our office, recognizing that our young people are really not only our future, but often those who are most vulnerable to being involved with violence, both as perpetrators and as victims. And recognizing also that that cycle is sort of circular, right? That victims are often become perpetrators and vice versa. So it's not as simple as sometimes we might think. We have had a long history of working with the Minneapolis Public School District and continue to really value that relationship. And one of the things that I think is exciting that we're working on with them right now is our group violence intervention, a juvenile version. Unfortunately, over the last several years, we've seen a number of young people more deeply involved with group dynamic, particularly, as I'm sure the listening audience has heard about, with the carjackings. And we know that whether there's formal group affiliation or just a group think mentality, we really want to support those young people in making better choices and being accountable. And when we talk about accountability, that's not just from a systems place, but it is really about them taking their rightful place in community as they emerge into adulthood. And so we've been working really closely with Minneapolis Public Schools to develop a system where we can help through community resources to touch the lives of those young people before it escalates to the point where they're in our juvenile justice system. So that's just one area. As it pertains to school safety, I know that the school district did make the decision to change their existing relationship with the Minneapolis Police Department and really focus on school safety in different ways. And I know that that work is ever evolving. They have hired staff who are working in each of their high school buildings who are focused on creating safety through non-law enforcement strategies. And we continue to provide technical assistance and support to them on that measure on a weekly basis. So we're definitely deeply involved and always looking for ways to work with them, both on that and other measures to keep our young people in Minneapolis safe.
Thank you so much. I noted on the results from the initial survey we did that one of the recommendations was community wealth building, which is certainly so important. We normally as something we in the health department do per se. And so just wondering if there are thoughts that you have about investing in the community beyond focused safety initiatives that might reinforce a safer community, might help us realize community safety for all.
Yeah, that's a great question, Gretchen. I think that this really gets to the notion of a more expansive approach to public safety and really thinking about our work in public health around primary, secondary, and tertiary prevention. As I mentioned earlier in the presentation, the base of the pyramid, primary prevention, is really about, in my own words and sort of the words that I'm borrowing from Anthony Smith, our colleague in Louisville who leads Cities United, it's really about building happy, healthy, and hopeful communities. And I think that it's no coincidence that health and wealth rhyme, right? That people who are well situated in life, who have their basic needs met, are far less likely to be involved with violence. And so one of the slogans that I've been chanting is suburbanize the hood. And it sounds funny, And I don't mean that in a way of saying we should create little suburbs throughout the city of Minneapolis. I think people love living in the city because of the diversity in perspective and culture and community that it provides. But what we know about suburban communities is that most people's needs are being met, particularly through government channels. And if we can bring that same kind of energy to the city of Minneapolis and really think about the least of these as we plan programs and plan our work, I think we'll see some real adjustments. And so we have been thinking a little bit more comprehensively as we think about transforming community safety and what it means to work in partnership with our partners in CPED and other departments that are more focused on financial issues and economic development. Because if we're going to see communities long-term thrive, investment is so important. And while we in the Office of Violence Prevention have to focus more in a nuanced way on keeping communities safe in the most literal sense of the word, we also need to be working with our partners throughout the enterprise and really through other jurisdictions on building out wealth, health, education, housing systems in order to see long-term reductions in violence.
And I will just add on that, if I could, briefly. I think it also challenges us to think broader about what it is that a safe community looks like. And a safe community doesn't mean there's a police officer on every block. It is communities that have those amenities that are meeting the needs of the folks who are living there, whether that be through, good lighting, great parks, healthy schools, all of those things, which I think contribute to healthy, wealthy, and safe communities. And by wealth, we don't necessarily mean by monetary investment, but what are the assets that are being contributed in that community?
Thank you. This conversation reminds me of a conversation I had with someone who's running for the park board coming up in our local elections next fall. And really looking at the investment in parks, the difference between an equality kind of perspective and an equity perspective. And are we well served by making sure all parks have the same stuff, at least up to a certain level? Or are there certain places where, to take your notion of suburbanization, whatever that might mean, invest more deeply and have slightly richer environments available in certain communities and not the communities that are already quite wealthy? So I'm excited. I'm having coffee with that candidate tomorrow. So looking forward to that conversation. We often feel the notion of safety at the local level, at the neighborhood level, at the community level. And we certainly saw in the aftermath of George Floyd's murder, we saw communities organizing themselves for safety and in ways that we had not seen before. And I know that in speaking with both of you that we've thought about how do we help communities who want to keep doing that, do that well. And then also, how are we thinking about that localization, that feeling of safety that varies from one geography to another, and working with neighborhoods and community groups around that?
Yeah, it's certainly something that we've been giving a lot of thought to and wanting to support those who have organized in the ways that you mentioned. And I think one of the ways that we're doing that is really trying to build stronger relationships with neighborhood and community relations within the city. And that's the department that works very closely with the neighborhood associations in each neighborhood. So each neighborhood in Minneapolis has a neighborhood association. And many of the groups that organize sort of organize around their associations. And so we thought that might be one way to begin to both help supply training and resource to those entities, but also to help organize them. But it is and remains a challenge, because I think part of what we saw as people, developed and grew these smaller groups is some of them take a bit of a harder look at government and what it owes to them and how they want to be attached to government. And so I think we also are thinking very deeply about the nature in which we should be engaged with those groups and how they want us to show up with them, whether that's by virtue of funding, support. One of the ways that we've really been thinking about it is through public training. And so the learning labs that we're offering will be one important tool, but also some ongoing training about safety in general and best practice if you're going to do community patrols and community watch groups, because let's face it, jumping into a set of circumstances, if you don't have the right training or the right tools to evaluate safety, can put a person at risk. And so we want to make sure that if people are doing what they feel like is best to keep their community safe, that they're doing it with the best skill set available. So training is probably the area in which we will focus the most on in this year, and we'll continue to grow out that body of work in partnership with neighborhood and community relations.
Thank you. So one question that came through has to do with streets, and I'm going to expand that to the notion of traffic. And we certainly know that traffic management often leads to unexpected outcomes. We also know that the city has recently reduced its speed limits in an effort to make streets safe from that perspective. And so just wondering if you have any thoughts or insights related to our streets and how we use them, or how we expect people to behave on our streets.
This is another area where I'm really grateful that Jen is a part of our team. And so I'm gonna have her answer that question.
Sure, happy to jump in. The city is involved in a project being led by our Public Works Department called Vision Zero. And the goal of that is to really reduce the amount of deaths related to traffic incidents for pedestrians and vehicles in our city to nothing. We want to get down to zero deaths. And we do that by not only enforcement, but how are we thinking about the design of our streets, and what are the different kinds of measures that we can implement and put in from both a structural perspective, using things like bump outs or bollards, protected bikeways, to even things like brighter crosswalks that are much more visible, that we can see when folks are driving around, to try to reduce those incidents where they are coming into contact with pedestrians or bicyclists. And I think that the goal there is to really think more broadly about our streets and how we use our streets in the city of Minneapolis. And that work is also being tied to the transforming work now. There was a staff direction authored to also look at non-law enforcement traffic enforcement and response. And so that work will be being built out over coming months. And that will be also co-led by our city's performance and innovation team, along with the Department of Public Works and the Minneapolis Police Department.
I think, Gretchen, your question also, is thinking about the stops that we know can sometimes lead to some very difficult outcomes, the law enforcement stops. And so I think, the work around looking at non-law enforcement response to traffic is one way that the city is thinking about really reducing that as a barrier, because we know that traffic stops and illegal substance in vehicles is often one of the, particularly driving without a license, is one of the largest entry points into the criminal justice system for people in general, but certainly for young Black men. And that the fines and citations that are often associated with those escalate when people don't pay them, and can sometimes lead to upwards of $10,000 worth of fines that put people in not only legal jeopardy, but in debt that is, astronomical. And so the Department of Public Safety, I know that there's a current bill up that's talking specifically about some of those issues as well at the state level, and we're tracking that work and supportive of it as well.
Thank you so much. Bill, I see that you are visible. Is it, have we run close to our end point, or can I ask one more question?
We are coming up to the end here, so I wanted take this opportunity to thank all of you, Sasha and Jen and Gretchen. Thank you, and all the people behind the scenes that are supporting you. It takes a team, I know that, to make all this happen. And we're grateful for your sharing resources, and suspect we might even want to have you come back at some point. But I do want to thank you for your perspectives and insights, all of you. Next week, we are going to continue building out our series with a group of students from the University of St. Thomas. And they are going to be presenting the results of an honors seminar on transportation and race. One of their assignments was to propose projects that would increase transportation equity in the Twin Cities, and to examine practical considerations in implementing their projects. And we'll have 5 project teams present their findings next week with what they've learned. Thank you all.
Thank you. Thank you for the invitation. We'd love to come back at any time.